Okay. Hello, everyone. This is Dr. Garrett Smith, also known as the nutrition detective around these here YouTube parts. And today we have a show that I wanted to cover today about, we're going to go over SIBO, which is small intestinal bacterial overgrowth, and leaky gut. In the research, it's also known as intestinal permeability, and how and how these things relate to toxic bile theory. Toxic bile theory being cholestasis, liver injury, and leaking toxic bile with all the things it contains, like copper and iron and manganese and vitamin A, back into your bloodstream. And we're going to go over how these things are connected, as I've done this with a bunch of disease states. So let me find the first one. So this is our live stream is not at our normal time today, so we may not have a lot of people show up. It's all right. If you show up and you got questions, today would be the day to ask them, because this is going to take a while to go through the leaky gut and the SIBO stuff. But if there's not very many people in the chat, you got a really good chance of getting your questions answered. So go ahead and post them if you got them, and then I'll get to them after I go through all of this. So let me find the first thing to go over. There we are. Okay. So first, I had told you previously in previous episodes, and I don't know if I've had this link up before, but I said that how did they cause SIBO in dogs? They gave them cholestasis. They gave them leaky gut. I'm sorry, they gave them cholestasis. They tied off their bile duct, called bile duct ligation, BDL. They tied off their big common bile duct, and they gave them, they gave them cholestasis, leaky bile. Okay, that is how they did it. So now, the dog one. Is this the dog one? Yeah. Sorry, let me do this one first. Serum unconjugated bile acids as a test for intestinal bacterial overgrowth in dogs. So what they're saying in the study of the title study, they're saying they can test for small intestinal bacterial overgrowth by how many bile acids are in the blood of dogs. Okay. So, wow, high incidence in dogs of small intestinal bacterial overgrowth, and it's hard to diagnose. Here, let me get the links for everybody. Oh, this is going to be fun. Let's do this. So they wanted to see what happens. Okay. Am I confusing these studies? Mean serum unconjugated bile acid concentrations were significantly elevated in dogs with SIBO. SIBO and toxic bile in the blood go together. Here's an important part. Gosh, do you think they're connected? Unconjugated bile acids increased 10 to 20 times, 10 to 20 fold in dogs with SIBO, indicating the clinical utility of serum unconjugated bile acids for diagnosis of intestinal bacterial overgrowth in dogs. So that's just for the diagnosis. I'm guessing that this is the one where they may have... No. So then I'm sorry, we're just going to show the same thing in humans too. Okay. Unconjugated serum bile acids as a marker of small intestinal bacterial overgrowth. Folks, those of you out there with SIBO who have been diagnosed with SIBO, and let's say they keep giving you these, antibiotic after antibiotic and crazy restrictive diet after crazy restrictive diet, the reason you're not getting better is because never are they dealing with your liver and the toxic bile problem that is related. So we're going to connect all this, okay? So they're saying non-invasive, they already said it's hard to test for, right? Non-invasive methods to detect small intestinal bacterial overgrowth often lack specificity in patients who have undergone an ileal resection. They've cut out part of their small intestine or have an accelerated intestinal transit. That tends to mean they've got diarrhea and things are moving too fast through their gut, okay? Since elevated serum unconjugated bile acids have been found in patients with clinical signs of bacterial overgrowth, we studied the clinical value of unconjugated serum bile acids as a marker of small intestinal bacterial overgrowth. So they're looking to see if it's connected. Here we go. Serum unconjugated bile acid levels above 4 micromole per liter were found in 8 of 10 patients with culture-proven small intestinal bacterial overgrowth, whereas serum levels above 4 micromole per liter were found in none of the patients from the 3 control groups. Okay, so they're saying people who didn't have small intestinal bacterial overgrowth never went above a 4. And then they found above 4 in 8 of the 10 with SIBO. So they showed it in dogs and they showed it in humans. What they're saying is, and I'm going to simplify this for you, SIBO is connected with a damaged liver injury, and leaking toxic bile back into the blood. So what's the mechanism of how this causes SIBO? One of the beneficial, I went over this, I think last week or the week before, one of the beneficial things of toxic bile is that when it goes into your small intestine, it will prevent certain bad bacteria from growing more. It is the bile that needs to go into your intestine to keep bad bacteria from growing out of proportion. Bacterial overgrowth, certain bacteria, you don't want them to get too out of control. The bile helps keep the populations of stuff we don't want in the small intestine down. That's how this works. That is one of the benefits of bile, okay? If your bile, if you had something called, let's say, intrahepatic cholestasis or other, even extrahepatic cholestasis. So intrahepatic cholestasis means it's leaking from the liver, basically directly into your bloodstream. Extrahepatic cholestasis means it's outside the liver is where the leaks are happening. But if you're leaking from the common bile duct, which is how the bile gets from the liver to your intestine, if you're leaking there or you're leaking directly from the liver into the blood, what happens is that bile never gets to your intestine. It goes back into your blood. If it doesn't go to your intestine, then stuff can start growing. And that's the connection here. That's why they're finding higher bile acids in the blood of dogs and humans when they're seeing small intestinal bacterial overgrowth and SIBO and high bile acids in the blood. That's the connection. They're connected. That's the mechanism. Okay? So we did that one. I think I may have in the dogs, I think I don't have the I guess I didn't find that dog study where they actually induced it in dogs by giving them cholestasis. I guess this is just a study showing the connections between it. I guess I didn't find that one. I'm not going to go find it right now. So now I wanted to go over the microbiome problems, how microbiome problems that they find in small intestinal bacterial overgrowth and bile acids connect, and how one can cause the other. You're going to see this as we go. Okay. Here's did I not get that other study? Did I not get that other paper? Let me get this one. Same one. Nope, that's the same. Let me get this one. That's the one we need. There we go. Now we're on to this one. Cirrhosis, bile acids, and gut microbiota. Okay, so liver damage, sick liver, bile acids, and your gut microbiome, which everybody loves to obsess on, right? Is it important? Yes. Let's get this link first. Okay. It's just I'm gonna give you the summary line that's really important here. Taken together, the bile acid pool size, how much bile, and composition, the recipe of the bile and how much. I talk about this all the time. Taken together, the bile acid pool size and composition appear to be a major regulator of microbiome structure, a major regulator. You ever been trying to fix your gut biome and you're just not getting anywhere because no one's talking about the bile? This is what we do here. which in turn appears to be an important regulator of bile acid pool size and composition. The balance between this equilibrium is critical for human health and disease. So your bile, the toxicity of your bile affects your gut microbiome. Your gut microbiome can actually turn certain bile acids, primary bile acids, into secondary bile acids, and it can conjugate or deconjugate, as in attach things to the bile acids or take them off, and makes the bile acid recipe more or less toxic. So then once your bacteria has affected the bile, it then goes back to the liver through what's called enterohepatic circulation. You reabsorb a lot of the bile, goes back to the liver, and if you have more toxic bile getting reabsorbed going back up to the liver, then you cause liver damage. Liver then puts out toxic bile, and you have this is what they're saying. It's saying it's a vicious cycle. You could be what's the term? That's the good cycle. I mean, a virtuous cycle. You could have a virtuous cycle where the liver, this is what we do. We're putting less toxins in the body and putting the right nutrients in the body so that the bile becomes less toxic. And then you fix your gut biome because that's the bile you're putting into your biome. The biome becomes less of a problem. The gut biome then doesn't make the bile as toxic, which then goes back to the liver, and we're getting better. This is how we heal. Most people, because they don't know what the actual toxins for them are, they're making it all worse. Like by taking things like vitamin A and thinking that copper is good for you. As you'll see, these aren't. So we got that one. Now, just wanted to show you a couple connections here. Liver damage in human small intestinal bacterial overgrowth. Sounds like they're connected, right? Okay. I didn't want to show a lot of papers here, but so they had, let's see, how many? 70 adult subjects were investigated for possible SIBO and hepatic damage. Okay. So they're looking for it. SIBO was present in 40 of 70 subjects. That's pretty high rate, right? Gosh, do I say that people have liver damage all over the place? Yes, I do. That is what's driving disease today. Biochemical evidence of liver damage was found in 0 of the 30 subjects without SIBO. The 30, SIBO was present in 40 of the 70 subjects. That leaves 30 with no SIBO, no biochemical evidence of liver damage. Gosh, guess they're connected, huh? Right? SIBO and liver damage and gut microbiome changes and toxic bile. 0 of 11 subjects with SIBO with salad. I'm not going to, you can read all this stuff if you want. Small intestinal permeability was increased, and along with liver enzyme abnormalities, normalized after eradication of SIBO. So they gave them most likely a bunch of antibiotics. Okay. Oh, wait, I got to get this. So they gave them a bunch of antibiotics. They saw that, okay, less SIBO because of how they affected the gut bacteria, which makes the toxic bile more toxic. So if you kill these things that are making the secondary bile acids and making bile more toxic, you could fix this problem. Does that mean it goes away? No, you haven't gotten rid of any of the toxicity. You haven't gotten rid of even the toxic bile problem. The antibiotics may have actually reduced your bile production even more. And how many of you out there went through a bunch of SIBO treatments and the SIBO kept coming back? That's what I'm saying. You're not fixing the issue. Okay. Oh, wait, hold on one second. Yeah, we'll do that. We'll do less light. So the permeability, remember, it's this cycle. The gut bacteria changes the bile changes the microbiome. You can change one or the other and affect the other side. But if you don't, why not fix both? That's what we do. Okay. Now let me see. Was this the paper that had the other ones? No. Okay. So let's go and let's keep going. Let me find where I wanted to look at on this paper. Oh, but also remember, SIBO, as they just said in that last paper, SIBO and intestinal permeability went together. If you watch either Love Your Liver live stream number 71 or number 53, they both cover the basics of toxic bile theory pretty well. Some people say they like 53 better than 71, so who knows? Leaky gut is caused by toxic bile eating holes through your gut. And they're saying SIBO and intestinal permeability went together. I'm going to show that a bunch here too. Okay. So now let me find association of small intestinal bacterial overgrowth with non-alcoholic fatty liver disease in children. So children getting fatty liver and also having small intestinal bacterial overgrowth. So again, I'm just connecting the liver problem to the small intestinal bacterial overgrowth problem. Okay. It has been suggested, so the research has demonstrated a connection, right? It has been suggested that small intestinal bacterial overgrowth, SIBO, could cause non-alcoholic fatty liver disease. So how would it do that? The bacteria change the bile. You reabsorb the bile, it goes back to the liver, it causes liver damage. Again, it's the bile damaging the liver. You following me? Let me see if I had anything else on this one. I don't remember. Oh, wait, I have the trick now. Yes. Yeah, this last one. This meta-analysis reports a possible association between SIBO and NAFLD in children. I don't know why it's not jumping to it. Usually it jumps to it. Anyway, whatever. Okay. And then finally, do these go together? Small intestinal bacterial overgrowth and intestinal permeability. So do you see how we're connecting the three? SIBO, intestinal permeability, and liver damage. Okay. Is this a one-off study? No, I went down here. Liver damage in human small intestinal bacterial overgrowth and small intestinal bacterial overgrowth and enhanced intestinal permeability in healthy beagles. So we could connect them all just with these links. There's that paper. Already put it there. Okay, so that's the vitamin A connection. I'm sorry, that's the bile connection. That's the bile connection. Now we're getting into the vitamin A connection. So what if we could show vitamin A connected to nearly all of these things? Hopefully I have these in a good order. Oops. Where is my thing? There we go. Okay. So now, one of the things I want to go over is the difference. One of the things that people will throw out in the research, like let's say Chris Masterjohn, who loves vitamin A, has talked about how certain studies show that fatty liver has a low amount of vitamin A in the liver and low retinol in the blood. Well, first of all, I've shown tons of research showing that blood vitamin A, serum retinol, does not correlate to how much vitamin A is in the liver at all. At all. You can have very, very low serum retinol, very, very low blood vitamin A, and have tons of vitamin A in your liver. They don't correlate at all. Okay. Now, the old research would tend to show that as the liver gets more and more damaged, fatty liver, cirrhosis, and all this stuff, that there is less vitamin A in the liver. So people who love vitamin A, which means they really don't like people, will say that vitamin A deficiency leads to fatty liver. Look, there's no vitamin A in the liver. So what if I were to show you a study where they basically go over and show that all the old research that said there was low vitamin A levels in the liver is wrong. So here's this paper. Impaired hepatic vitamin A metabolism in NAFLD, that's fatty liver, non-alcoholic fatty liver disease mice, leading to vitamin A accumulation in hepatocytes, liver cells. Vitamin A is accumulating in the liver cells in fatty liver. Okay. Did I highlight this one? Yes. Why is this not jumping down to it? It used to jump down to it. I got to go all the way to the bottom of this. If it's even still marking it or if GLASP is going all weird. Okay, let's just do a Control F. Okay, here we go. We compared both methods, so that they're talking about the old method of looking at fatty liver, the one in all the crappy studies before, and the new method that they're using here. We compared both methods and found that acetonitrile very inefficiently extracts retinol palmitate. That's the highest retinol ester, the form of vitamin A that's stored in the liver in humans. This is the one that's it's like 60 or 70% of the vitamin A in the liver is bound to palmitic acid. It makes retinol palmitate. So if you're out there saying that synthetic vitamin A, retinol palmitate, is never found in the human body, no, it's actually the most prominent vitamin A form in the human liver. So synthetic retinol palmitate and natural retinol palmitate from cod liver oil or whatever is indistinguishable to chemists, and therefore it is indistinguishable to your body. So don't try to say they're different. It very inefficiently extracts retinol palmitate specifically from fatty liver tissue where they need to look, while retinol extraction was similar with these solvents. This suggests that the extraction of retinol esters by acetonitrile is compromised when a lot of fat is present in the liver tissue. So the very time that you want to find a fat-soluble toxic compound, people incorrectly call it a vitamin, in fatty liver is when you can't, the more fat there is, the less you can find it. Especially this latter procedural finding may explain the controversial findings on retinol ester levels in fatty liver. Controversial means some people are finding tons of it, and some people aren't finding hardly any at all. There's tons of vitamin A in fatty liver. Here, let's go look at a picture. Let's add a new tab to the right. Let's go fatty liver. Let's just go and look at images. What color? Let's look at this one. What color do they make fatty liver? Pretty yellow, right? Okay. What else is yellow? Toxic bile and vitamin A. Okay, let's find the actual pictures. Look, here's more of a real looking picture. They color it yellow. Yellowish. Again, it's not the burgundy of a normal liver. It's fatty and it's yellow. That's the way they color it. Oh, look at that yellow. So, non-alcoholic fatty liver. Yellow. It is storing tons of vitamin A in it. That's what the research shows. Healthy liver, fatty liver. Healthy liver, fatty liver. Gosh, that looks yellow to me. Or orangish. Gosh, like sweet potatoes, mangoes, or is it papaya? I don't even remember. I don't eat them anymore. I don't want to. So that's that. And there's one other paper real quick. Disturbed vitamin A metabolism in non-alcoholic fatty liver disease. So this is how mainstream tries to gaslight people into thinking that somehow, because your vitamin A metabolism, which is your detox pathways, are broken, you're not making enough of the right type of vitamin A, and that's why you're suffering from something. There are people out there who say there's no such thing as vitamin A toxicity. There is only deficiency because your metabolism of it is broken. They're wrong. You can be toxic in any form of vitamin A. They are all toxic. Some of them are much more toxic than others. So, non-alcoholic fatty liver disease is the hepatic manifestation of metabolic syndrome. Well, didn't we just go over metabolic syndrome and vitamin A toxicity like a couple weeks ago? And is a spectrum of conditions ranging from benign hepatic steatosis, fatty liver, to non-alcoholic steatohepatitis. It may progress to liver cirrhosis and liver cancer. NASH is projected to be the main. NASH is projected. Non-alcoholic steatohepatitis is projected to be the main cause of liver failure. You're dead, or you need a liver transplant in the near future. Okay, let me go find the next part. Will it jump to this? No, man. Okay, let me look that up. Enhanced. There it is. Get out of here. Oh my goodness. Get out of here. Enhanced retinal just highlight it. Enhanced retinal esters in the liver of NAFLD patients. That means more. Low circulating somebody share this with Master John. Low circulating retinol in non-alcoholic fatty liver disease may therefore not reflect true vitamin A deficiency, like that even exists. It doesn't. But rather disturbed vitamin A metabolism. They have to save its reputation. Here we summarize current knowledge about vitamin A metabolism in NAFLD and its putative role in the progression of liver disease, as well as the therapeutic potential of vitamin A metabolites. Oh, if we just give them different forms of vitamin A, we can fix it. No. I just showed you that there's more vitamin A in fatty liver. Gosh, how could somebody have low vitamin A in their blood and too much vitamin A in their liver? Is their liver sucking it all up like a dry sponge does to water and holding on to it? And then the liver's taking the damage and it's not leaking as much into the blood? What do you think the faster way to get liver damage is? For the liver to hold on to all that toxic vitamin A? Yes. The research on fatty liver and vitamin A has been completely wrong up until that study. When was that one? When was this? 2021. They only figured this out in 2021. I want to thank Laura Bejanaru, who is a Love Your Liver program member, for bringing that. She does great research. She brought this to my attention. So we obviously have a vitamin A problem in liver damage. Okay. Liver damage is associated with what? SIBO. Oh. Now, this is another paper I've talked about many times. The retinoic acid peel. So just so you know, any type of provitamin A, beta carotene, retinol, retinaldehyde, it's going to eventually turn into retinoic acid, which is what they claim is active vitamin A. This is the one you need. I want you to understand, when you talk about leaky gut, retinoic acid, I want you to hear about what it does. Imagine if this could dissolve your intestinal lining. Chemical peels may be defined as, quote, controlled wounds of the skin made by the dermatologist to multiple purposes. They are classified as superficial, medium, and deep wounds. Deep controlled wounds, according to the depth of penetration of the chemical solution. Remember the title, retinoic acid peel. Let me put this in here. For the last decades, retinoic acid has been used in higher concentrations for superficial peelings. They call it a yellow peel. They put retinoic acid on women's faces and dissolve the upper layers of skin, inducing a controlled wound. Do you think that what's going on in your gut when your liver dumps a bunch of toxic bile and it's coating your intestines, that this is a controlled wound? Or is it an uncontrolled wound? I'm going to go with uncontrolled. Now, does vitamin A damage the gut? Do we have any evidence of this? Or is it just me theorizing on chemical peels based on the chemical knowledge of them? What we know, I don't know if you guys know this, but in naturopathic medical school, they say if you have skin problems, you probably have a similar condition going on inside your intestines. Oh, well, what did they just say retinoic acid does to your face? Dissolves layers of skin. So what do you think it's doing to your intestines when the bile is being dumped like 12 times a day or something like that? It's dissolving your intestinal lining. Okay. That's not even the bile acids. So here we go. Retinoic acid primed. Human dendritic cells, those are nerves, inhibit Th9 cells and induce Th1 to Th17 cell differentiation. Well, what does this mean? What does this mean? How do they simplify it? These data revealed that in the face of inflammatory conditions, retinoic acid, in contrast from its anti-inflammatory role, could maintain or aggravate the intestinal inflammation. So you're already in an inflammatory state, and retinoic acid is kicking you while you're down. Sounds pleasant. Next. So remember the connection: SIBO, intestinal permeability, liver damage. Okay. Retinoic acid suppresses intestinal mucus production. Your intestines make mucus to protect themselves against the stuff in the bile. Oh, vitamin A stops them making protective mucus and worsens experimental entero, that's your guts, your intestines, colon, small intestine, large intestine. Look at how they start with this statement. Exposure to retinoids, that's vitamin A, folks. That's the family of vitamin A, for the treatment of acne has been linked to the etiology, the cause of inflammatory bowel disease. Well, that's a statement. Okay. Suppression of mucin production by retinoic acid increased the susceptibility of zebrafish larvae to enterocolitis when challenged with enterocolitic agents. As they just said in the study before, when there was already a problem going on, vitamin A made it worse. That's what we just said before. That's what they're saying now. This study illustrates a direct effect of retinoid administration, vitamin A administration, on intestinal mucus physiology and subsequently on the progression of intestinal inflammation. Let's keep going. Did I get this one? Yeah, I think I did. Next. Now remember, some of all the vitamin A you eat turns into retinoic acids. When they just talk about retinoic acid in studies, they're typically referring to specifically all trans retinoic acid. That's tretinoin, what they're selling on Instagram. Like you don't even need a doctor's visit. You can just like fill out a form online and they'll send you your tretinoin so you can go die early and ruin your gut. Okay. So let's go over this one. Retinoic acid signaling modulates, as in controls, recipient gut barrier integrity. Hey, intestinal permeability. And microbiota. Hey, gut biome. After allogeneic hematopoietic, this is to make red blood cells, stem cell transplantation in mice. Now I want you to, this is what they thought first. We hypothesized that vitamin A and retinoic acid exert positive impacts on maintaining intestinal barrier function after hematopoietic stem cell transplantation, HSCT, thus preventing or dampening GVHD, graft versus host disease severity. Okay, so what did they actually find though? Unexpectedly, we found that exogenous retinoic acid, giving retinoic acid from the outside, increased intestinal permeability of recipient mice after allogeneic HSCT. For those of you who are repeaters, taking all your vitamin A and your carrot salad and you're eating your liver and your eggs, serum bacterial endotoxin. For those of you who want, endotoxin is a real thing. Serum bacterial endotoxin levels were significantly higher in graft versus host disease mice fed a vitamin A high diet compared to those fed a vitamin A normal diet, indicating a more compromised intestinal barrier function. Furthermore, high vitamin A mice showed more severe lung graft versus host disease with increased donor T cell infiltration in this tissue. That's not good. And died significantly faster than vitamin A normal recipients. 16S rRNA sequencing of fecal samples, poop, revealed significant differences in the diversity and composition of gut microbiota. They're changing the gut microbiome between vitamin A normal and high vitamin A transplant recipients. Collectively, we show that retinoic acid signaling may negatively impact intestinal barrier function during graft versus host disease. Mild vitamin A supplementation, I want you to catch that word. So they said vitamin A high, but that's not what they're about to say right here. Mild vitamin A supplementation, that was the vitamin A high diet, is associated with increased lung graft versus host disease and a more profound gut dysbiosis. More intestinal permeability, more gut dysbiosis by giving mild supplementation of vitamin A. If you are out there eating liver, if you are out there taking cod liver oil, if you are taking multivitamins, you are way above mild supplementation. If you're trying to eat sweet potatoes and carrots and spinach, thinking you're being all healthy, no, it's not going to end well. I'm sorry. It's just not going to end well. Let me see if I had anything else on this one. I don't think I did. Nope, that's that. Next one. Oh, wow, I'm way down here. Here we go. Retinoic acid, leaky gut, and autoimmune diseases. So this whole paper, I just want to say, this whole paper spends the entire time trying to talk about how retinoic acid is good. They spend the entire paper talking about how it's good. It's probably good, probably helps. But then, thank goodness for this author's honesty, because there's one little paragraph at the end, one little part of a paragraph at the end, where they question everything that they just went over. Here we go. Furthermore, although beyond the scope of our review, or they didn't want to make vitamin A look bad, but they wanted to throw this in there. Evidence exists linking retinoic acid toxicity, that's vitamin A toxicity, to several acute and chronic diseases. There is also evidence that retinoic acid can cause a temporary feedback inhibition to the production of endogenous retinoic acid itself. So what I'm just real quick, the more retinoic acid your body is making, it feeds back to ALDH, which is what makes retinoic acid, and tells it, please stop making more. Because if you make too much retinoic acid, we are going to fall apart. So the body will slow down the production of retinoic acid to protect itself. That's how toxic this stuff is. You need to make it to get rid of it. That's part of how you get rid of it. Retinoic acid is water soluble. That means you can then not only get rid of it through the liver and the bile, but you can get rid of it through the kidneys. And the liver through the cytochrome system and conjugating it can actually bind things to the retinoic acid or change the structure of it in certain ways so that it becomes, there are less toxic forms of vitamin A. So your body is trying to protect you. Retinoic acid is generally the most toxic form of vitamin A, but the detox process has to go there. Therefore, many of the short-term observations described in our review may be temporary consequences due to the feedback inhibitory effects of retinoic acid, and that longer-term observations could actually reveal toxic effects that may, in fact, indicate a causal role for retinoic acid in these same autoimmune diseases. Thus, our hypothesis of the link between retinoic acid leaky gut and autoimmunity is relatively weak and requires more supporting evidence. Let's just stop for a second. If you guys were live, I'd ask you, somebody tell me what they just said. What's the two-word thing that we talk about here where things that can look good in the short term actually ruin things in the long term? We have a two-word term for that. We call it the duration paradox. This is what retinoic acid and vitamin A studies are classically like. Retinoic acid looks great in a cell study. Looks great. Long-term study in actual animals or people, it's a disaster. They just said it. We talk about this all the time. So if you come at me with a short-term study on vitamin A or a cell study on vitamin A, I'm going to say, yes, probably seen it. And in real people or animals, long-term, it's exactly the opposite. Just like, let me just read this one again because it's nice that they say it specifically. Therefore, many of the short-term observations described in our review may be temporary consequences due to the feedback inhibitory effects of retinoic acid, and that longer-term observations could actually reveal toxic effects that may, in fact, indicate a causal role, root cause, for retinoic acid in these same autoimmune diseases. Okay. Let's keep going. So now this is going to be a fun connection. Those of you who are familiar with cleft lip, cleft palate, vitamin A toxicity is part of the cause of it. Vitamin A and clefting, putative biological mechanisms. They wouldn't make this statement if they didn't have evidence, right? Excess vitamin A can cause congenital malformations such as spina bifida and cleft palate. In general, high doses of vitamin A affect palatogenesis, the formation of your palate, through interference with cell proliferation and growth factors such as transforming growth factor beta and platelet-derived growth factor. Excessive vitamin A may disturb all three stages of palatogenesis. Now, this probably plays into tongue ties too, but I couldn't find a lot of research connecting it. But those are all midline, defects. So, how are we going to connect this? Okay, so they just connected. They've got data, lots of data connecting clefting, cleft lip, cleft palate with vitamin A toxicity. So let's go into this next one. Novel investigations in retinoic acid-induced cleft palate about the gut microbiome of pregnant mice. In our research, we used retinoic acid to induce cleft palate model. What is the only vitamin that they talk about restricting during pregnancy, folks? It's vitamin A, because it's not a vitamin. They actually recommend pregnant women get less vitamin A than normal people to prevent birth defects by the Teratology Society, the society that tries to help you prevent birth defects, ladies and caring husbands. So I'm not trying to scare you away from lactobacillus here. And can you have too much of it? Sure, you could. Could you have it imbalanced? Sure. Compared with the control group, lactobacillus in the gut microbiome of the retinoic acid group was significantly increased. Not everybody does well with lactobacillus. Here's a weird coincidence. What type of cultured food tends to grow lactobacillus really well? Is it dairy? What does dairy have a lot of it in? What does dairy have a lot? What does dairy contain a lot of? Blech. Vitamin A. Vitamin A is in the fat. It's in the casein. It's in the whey. Yes, it is. It's in the research. So would maybe the lactobacillus does something with vitamin A? Yes, good job, Butch. Our findings indicate. Did I do this one yet, Joe? Let me do this one. Our findings indicated that changes in the maternal gut microbiome. This is, again, these are not native English speakers. Our findings indicated that changes in the maternal gut microbiome palatal development, which might be related to changes in lactobacillus, and capitalized, these results provide a new direction in the pathogenesis of cleft palate induced by retinoic acid. Okay, so we just connected the microbiome and cleft palate and vitamin A. Okay, so now let's do this last one. Novel insights into a retinoic acid-induced cleft palate based on RAC1 regulation of the fibronectin arrangement. Retinoic acid-induced cleft palate results from both extrinsic... Did I do this one? 2.6, yeah. From both extrinsic obstructions by the tongue and internal factors within the palatal shelves. They're trying... Do you see what they just did? They tried to blame vitamin A-induced cleft palate as resulting from extrinsic obstructions by the tongue and internal factors within the palatal shelves. So either it's messing up the palatal formation, or it's saying it's messing up the tongue. Did you hear? You remember me mention tongue tie? Or internal factors within the palatal shelf. So it's malforming your bones. Okay? I think that was it on that one. Yeah. But this is just the apologetics where they just try to shove the blame anywhere they can other than vitamin A toxicity. So that's vitamin A. Wow, we're only through vitamin A, but those were the biggest ones. Let's get rid of the SIBO one. Okay, so now let me find the third one. Okay, so let's go into copper. All you protocol and revolution people poisoning yourselves. I'm trying to help you not do that. Bioavailable copper is a made-up pseudoscience concept. It's garbage. It's not that copper is necessary when it's bound to something and it's toxic when it's not. That would be really strange. It's less toxic when it's bound to things. It's more toxic when it's not. So, does copper connect to damaging the liver? Yes. Does it connect to leaky gut? Yes, we're going to show that. Does it connect to changing the gut microbiome? Yes, we're going to show that. So let's go into this paper first. Good morning, Joe. Zendog breath. The significance of variations in the distribution of copper in liver disease. People will be like, well, the liver doesn't accumulate copper. No, and the copper doesn't damage the liver. No, yeah, totally. Okay. Biopsy. That's what we want to see. Biopsies. Biopsy and autopsy specimens of liver from patients with Wilson's disease in various stages. That's a copper accumulation disease, a disease where you can't get rid of copper fast enough. Okay. In various stages, chronic cholestatic conditions where you're leaking toxic bile into your bloodstream, including primary biliary cirrhosis, extrahepatic, outside the liver, biliary obstruction, that's cholestasis, sclerosing cholangitis, that's where the bile ducts are like scarring shut, and biliary atresia, that's where the bile ducts are just like disappearing, shrinking and disappearing. Chronic active hepatitis. Don't forget to find my hepatitis episode of the live stream. And Indian childhood cirrhosis, as well as normal neonates, normal newborns, were examined by means of histochemical techniques for copper and copper-associated protein. That I don't know if they mean ceruloplasmin by that. Periportal hepatocytes, just remember liver cells, containing granules, lysosomes, that were reactive for copper, they have copper in them, and for copper-associated protein. Wait, why isn't it protecting them? Were characteristic of cholestasis. They found copper and copper-associated protein characteristic of cholestasis and neonatal liver. However, in cholestasis, extra-lysosomal copper, so copper outside the lysosome, was often present in the hepatocellular liver cell cytoplasm. Copper's everywhere. Everywhere. In Indian childhood cirrhosis, how toxic are these kids? They're kids, they're newborns, and basically, or children, and they've got liver cirrhosis. Copper was present throughout the parenchyma with periportal predominance. Differences in the distribution of copper and the cellular changes associated with its deposition and with its deposits suggest that different pathogenetic mechanisms and possibly different intracellular targets are susceptible to the toxic effects of the metal. So, they find lots of copper all over the place in cholestatic livers. Okay. Cholestatic livers and toxic bile leaking into the blood is associated with SIBO. SIBO is associated with intestinal permeability and a gut microbiome being messed up. Oh yeah, Joe was saying in India they often drink out of copper cups. They think it will kill pathogens. It does kill pathogens, and it slowly kills them too. So yeah. You have to remember, whenever you're using something to kill people, kill something, folks, it could be killing you at the same time. Like antiparasitic drugs. If something is so strong it can kill something living like a parasite, it could probably kill you too. It definitely damages your liver. So let's go. The effect of dietary copper on intestinal microbiota and antimicrobial resistance profiles of E. coli in weaned piglets. I remember I got a copper cup back when I was like, was it medical school? Or maybe a little bit afterwards. I got a copper cup because back then I was drinking alcohol, and I thought, oh, a copper cup, I'll make Moscow mules because I liked ginger ale and I liked, I forget the alcohol they use in it, but I thought I'd make that. I drank out of the copper cup. I was like, this taste is disgusting. The copper flavor is awful. My body just protecting me, saying, this is bad. So what happens in the piglets? Thus, a pharmacological dose of copper affected the composition of the microbial community, changed their gut biome, increased the antimicrobial resistance rates of intestinal E. coli. Copper made the gut bacteria more resistant to antibiotics. Gosh, do you hear about that today? and was most likely harmful to the health of piglets at the early stage after weaning. It increased the richness of E. coli in the hindgut. So copper made more E. coli and made it more drug resistant. Yeah, multiple drugs. Sorry, we don't want to miss this. Okay. Now, what happens in humans? Effect of acute copper exposure on gastrointestinal permeability in healthy volunteers. Bad for the people who signed up for this study. In vitro studies, cellular studies indicate that treating cells with copper results in alteration of tight junction permeability, aka leaky gut. In humans, ingestion of a single bolus of up to 10 milligrams of copper per liter as copper sulfate causes nausea and vomiting in approximately 20% and 5% of the volunteers, respectively. Okay, so they mean it'll cause 20% of the volunteers get nausea, 5% of them actually vomit it up. Does that sound like your body likes it? Does that sound like a revolution to you? It's not the form of it. Copper 1 or copper 2. Copper 1 is going to oxidize in your body. Oh my gosh. That'd be like thinking that iron's not going to oxidize in your body. Once it breaks off of anything that's holding it, it oxidizes. Even the MitoSynergy ad on YouTube shows that it just takes like 30 seconds to a minute to oxidize. It doesn't not oxidize. Forget about bioavailable copper unless you want to damage yourself, and then come here when you're damaged and I'll help fix you. Okay, so I want you to understand 10 milligrams of copper per liter, that's a concentration. That's not how much they actually drank. Okay. So 31 asymptomatic subjects were assessed in a randomized double-blind crossover study that included 2 permeability tests. One after ingesting 200 milliliter distilled water, so no extra copper, and the other after ingesting 200 mils of water containing 10 milligrams of copper per liter. So a liter is 1,000 milliliters. So they only took in 20% of a liter. So they only took in 2 milligrams of copper. I want you to understand. Okay. Wait. Let me go. Okay, I want you to, okay, so Joe, go to this screen. So they're taking in 200 milliliters, 20% of a 10 milligrams per liter. They're taking in 2 milligrams of copper. That's the math. 2 milligrams of copper is this supplement. 2 milligrams of copper, this supplement. 2 milligrams of copper, this supplement. 2 milligrams, 3 milligrams. 2 milligrams is a totally normal copper supplement. Totally normal. 20, but it's in a capsule, so they bypass your body's safety mechanisms. 20% of guys got nauseous, 5% of them vomited it up. When their body got the signal in the mouth and the esophagus and the stomach, because capsules can sometimes get past the stomach before they dissolve. When they got the signal early on in their digestive tract, their body was like, oh, stop it. Get this out of me. Okay? So, wait, where was I? Here we are. So 2 milligrams of copper. Gastrointestinal symptoms were reported during both the basal and the experimental conditions. So basal was the distilled and experimental was the copper. So if they drank too much water too quick, they could not feel good. But after copper ingestion, they increased to 22.6% of the subjects and were significantly more intense than under basal conditions. These results indicate that acute oral exposure to 10 milligrams of copper per liter, 2 milligrams of total copper, exerts an effect on gastric, but not intestinal mucosa, reducing the gastric mucosal barrier capacity. So it's causing leaky stomach. It's eating holes in the stomach. Gosh, why would they get nauseous and vomit? I can't figure it out. Independently of the appearance of gastrointestinal symptoms. So they could be having leaky stomach happening without symptoms, and they could be having symptoms happen without as much leaky stomach. Does this sound like something that's good for you? So let's keep going now. Did I do this one? Hold on. Okay. So, more on copper. Those of you who think copper is good for you, I'm just sorry. I'm sorry. You were duped. Toxicity, gut microbiota, and metabolome effects after copper exposure during early life in SD rats. Copper can be harmful to health and has a significant impact on the gut microbiota, which is closely related to health when copper is ingested excessively. Here are the effects of early life exposure of copper on the toxicity, gut microbiota, and the metabolome. A lot of times they get into bile and metabolomics. I didn't get that deep into the study. I don't think I saw that part. Were investigated in Sprague-Dawley rats, that's SD. The results showed that 0.2 and 1.0 milligrams per kilogram body weight copper early life exposure in SD rats significantly increased ALT, AST, and ALK-Phos, alkaline phosphatase, ALP levels in the blood and caused liver damage. Those are liver enzymes. Copper exposure had a dose-dependent effect. The more you take, the worse the problem. On the alpha and beta diversity and reduced the abundance of probiotics. The ratio of firmicutes to bacteroidetes, I don't remember, for those of you who may have seen, there was research, I believe, on bacteroids to firmicutes in terms of obesity. I think we went over copper and obesity in a live stream here before. And changed the abundance of fat metabolism and intestinal inflammation-related bacteria. The results of the fecal metabolome, also, that's the metabolomics, they're analyzing what's in the poop, also demonstrated the effects of early life copper exposure on liver damage and intestinal inflammation-related metabolic pathways. Together, our findings demonstrated that copper exposure during early life induced liver damage and gut microbiota dysbiosis and affected the relevant metabolic pathways. You know what's happening to kids these days is, especially ladies, you got to stop taking and giving your daughters birth control pills. Birth control pills raise vitamin A, raise copper in the blood. It damages your liver. You're going to be pumping more copper into your blood. You should see the levels of copper that I see in pregnant women. And then when you're nursing, they just said early life copper exposure. Where do you think that copper is going to come out? It's going to come out in the breast milk. You see here, the liver damage from early life copper exposure. I've shown research on how a vitamin A toxic mother mouse could actually kill her babies with vitamin A toxicity coming out in the milk. Okay. Birth control pills make this worse. Did I do this one? Yeah, I did this one. Yep. So just remember, guys vomiting from 2 milligrams of copper. If you take them, if you're still taking a multi, you're probably taking at least 1 milligram and causing liver damage. Okay, so there's copper. Let's go into iron now. Vitamin A increases iron absorption, if you did not know. Vitamin A toxicity and copper toxicity absolutely go hand in hand. Serum ferritin in neonatal cholestasis. Oh, for those of you who haven't seen it, I forget which episode it was, maybe 103 was the ferritin episode, where I go over ferritin and cholestasis and leaking toxic bile and all that stuff. Okay, so cholestasis is leaking toxic bile. Neonatal is newborns. Newborns already leaking toxic bile. They're probably already really jaundiced. And what's their serum ferritin? Moreover, serum ferritin was significantly higher in those with intrahepatic cholestasis. So high, and I go over this in the ferritin episode. Ferritin and serum bile are linked. Didn't I do this? Oh, okay. When I have so many studies, I get off a little bit. Anyway. Conclusion: serum ferritin is non-specifically elevated in neonatal cholestasis with positive correlation to hepatic iron grades. Neonatal cholestasis, leaking toxic bile into the blood. Higher serum ferritin, leaking toxic bile with ferritin in it into the blood. With positive correlation to hepatic iron grades, to correlating to how much iron is stuck in the liver. Serum ferritin over 803.5 nanograms per mil. If that's the normal, I don't remember the normal units off the top of my head for serum ferritin, but if that is the normal unit that I normally look at, an 800 is huge. Those of you who have worked with me on ferritin know that you're probably looking at this going, what? Like, yeah, we don't usually see this. I very rarely do I come across an adult male this high. Can predict higher grades of hepatic iron. Okay, so that's iron. So iron, obviously, high serum ferritin can go with we can go with cholestasis, leaking toxic bile. We know that leaking toxic bile goes along with SIBO and intestinal permeability and gut microbiome problems. Okay, so what's the next one? The impacts of iron overload and ferroptosis. Let's just define that just so everybody has it. Programmed cell death dependent on iron and characterized by the accumulation of lipid peroxides. Oh, like malondialdehyde? We never talk about that. And is genetically and biochemically distinct from other forms of regulated cell death such as apoptosis. So iron, excess iron killing cells. Okay? Did this just make them disappear? No. Okay, so nevertheless, iron supplementation. Not only does iron accumulate in your liver, right? Nevertheless, iron supplementation results in excess iron accumulating in the intestinal tract, in your guts. That can also catalyze the formation of reactive oxygen species and cause intestinal damage, which increases intestinal susceptibility to the toxic effects of iron overload. So the iron accumulates in your intestines. It can then cause damage. You could leak more iron and then cause more iron overload toxicity. Numerous studies have shown that iron overload can cause iron deposition in the intestinal mucosa, which in turn damages intestinal mucosal homeostasis and increases inflammation and lipid peroxidation, as well as cell death, such as ferroptosis, resulting in various intestinal diseases. Remember, vitamin A damages your gut directly, and vitamin A increases your iron absorption. So if you're on a protocol and you want to fix your iron overload and you're taking in a lot of vitamin A from cod liver oil or wherever it is, you're going the wrong direction. Okay. Do we not have this one yet either? Let's see. Where's that? this one 30833? Yeah. Okay, got it. Now, this last one, this is just a search. I didn't want to go through the papers on this one because I thought the titles told it enough. Does iron change your gut microbiome? We just read about how it could basically increase your intestinal permeability. Okay, accumulates in the gut lining and causes problems. So here we go. Iron reshapes the gut microbiome and host metabolism. Gut microbiota and iron, the crucial actors in health and disease. Iron supplementation influence on the gut microbiota. So, does it sound like iron affects your gut microbiome? Yeah. Permeability, microbiome, small intestinal bowel, bacterial overgrowth, liver damage. Okay, same stuff we connect every time. So let's move on. Let's go to, what are we on now? Oh, zinc. So now we're going to go into the good stuff. What do we tend to do now? I will tell you, I don't think I have magnesium researched. I'll probably do that as we go. I go over typically magnesium, potassium, zinc, selenium. There's not much research on molybdenum. There's just not much research on molybdenum, but it's hugely important. And we go over how these things benefit. Typically, if I'm able to, I try to show that deficiency is connected with the disease state and that supplementation helps the disease state. And then we can be pretty sure that we're on to something. This last part, the nutrient part, I was a little short on time, so we may not have all of that stuff. Oh, what's this study? Zinc supplementation tightens leaky gut in Crohn's disease. Wow. Do we really need to go further? Or our findings show that zinc supplementation can resolve permeability alterations in patients with Crohn's disease in remission. Improving intestinal barrier function may contribute to reduce the risk of relapse in Crohn's disease. And they even used crappy oral zinc sulfate. Garbage. They were not giving 110 milligrams of zinc. That's not how zinc sulfate works. They don't know how to write it in studies. They need to say the elemental zinc. This is not 110. They're not giving them 330 milligrams of elemental zinc. So, let's go again. Prevention of alterations in intestinal permeability is involved in zinc inhibition of acute ethanol-induced liver damage in mice. There's groups out there who follow protocols who are adamantly against zinc supplementation. And they take copper. They emphasize copper. What do you think that's doing to their leaky gut? The inhibitory action of zinc on alcohol-induced liver damage. Never forget that vitamin A is an alcohol. Retinol is an alcohol. Alcohol-induced liver damage and activation of inflammation was associated with zinc suppression of alcohol-induced intestinal permeability changes. These results thus demonstrate that zinc prevention of increased intestinal permeability is importantly involved in the inhibition of acute ethanol-induced liver damage in mice. Okay. And I just want to go over this. Where is it? Oh, it disappeared. You just saw it. Y'all saw it, right? And it just disappeared. One thing I emphasize to people in the program is that you need meat. If you want to try to do this with vegan, good luck. It's really hard to get enough protein, and the problem is the protein comes with tons of anti-nutrients and low zinc and excess copper, Like a plant-based diet, they want you on a plant-based diet because it's high in copper, it's high in vitamin A. It's going to poison you. And it's lacking in protein. So, well, let me just read. Hold on. Let me do this one. Let me do this. Okay, Joe, you may want to pin this one or Audrey's testimonial here. I'm 65. My LDL tests over 300 without statins. We're going to fix that. Just stopped taking Crestor per Dr. Smith. Neck pain ceased and energy levels restored. I'm active and on OTW. I don't know what that's standing for. Generally healthy on the detox diet for 3 years. Actually, Audrey, I'm just going to, the secret weapon that Kelsey and I are working on, I know I've been talking about it for several weeks. The plan is to have it out this week. So any of you who are on the Love Your Liver program, or if you're not on the Love Your Liver program, we're going to be sending out emails. We're going to be sending out announcements on the network. We're going to be posting it on all the social media. There's going to be something that is going to absolutely help accelerate your results and help with cholesterol. My LDL used to be over 200 by itself. So, yeah, we're going to fix all that. And I have my, otherwise, that's what it means. Okay. Otherwise, got it. So we're going to be fixing all that. Okay. So here's this paper. Let's go back to this paper, Joe. Recent clinical and experimental findings have reinforced the link among zinc deficiency, malnutrition, and diarrheal disease. Diarrhea is often too much or too toxic bile in the intestines. Okay. Because there is a strong association between protein and zinc content in virtually all types of foods. The more zinc, the more protein in general. Insufficient protein intake may often be the cause of zinc deficiency. Compensatory mechanisms operating in monogastric species during malnutrition are less effective for the absorption of transition divalent elements such as zinc, which remain bound to ligands of dietary or endogenous origin. This is the important sentence here. Both protein and zinc deficiencies are strong negative determinants. They make they're looking in a bad way, a bad sign. Strong negative determinants for normal cellular immunity. The vitamin A deficiency studies and vitamin A toxicity always has a zinc deficiency component to it and a protein deficiency component to it. Some of these guys out there who are taking tons of vitamin A, they're usually young and they're doing like crazy amounts of protein. That's the only reason they're somewhat protected, is they're getting quite a bit of zinc and quite a bit of protein. It doesn't mean it's not accumulating in their liver. So here, let's just do this. Let's do this real quick. Let's do zinc microbiota PubMed. Dietary zinc alters the microbiota. What zinc did they give? Okay, well, let's talk about this. Excess dietary zinc. Do I talk about how it's possible to take too much zinc? Anybody remember me doing this over and over before people go out and get stupid with their zinc doses? If you are out there and you're going to get stupid with your zinc doses, and by stupid with your zinc doses, I mean over 60 milligrams for a long period of time, like 6 months or more, you're probably going to cause problems. If you're testing and not guessing, maybe working with me or Nathan, sometimes we go up there, but it's never meant to be long-term. I've had multiple people who did what I consider stupidly high doses of zinc, and they eventually got to the point where they're like, "Oh, Dr. Smith, you were right." So this is a zinc toxicity study. Here we show that excess dietary zinc substantially alters the gut microbiota. Oh, No joke? Really? You could take too much of something? I'm not doing anything else with this paper. Here we go. Well, wait. Oh, they only looked at high zinc or zinc overload on gut microbiota. Are they trying to avoid proper zinc levels and look at it with the gut microbiome? Effective long-term and short-term imbalanced zinc manipulation. Wow, it's almost like they're trying to avoid showing it. Why would they do that? Oh, I already saw that one. Anyway. Alteration of gut microbiota associated with zinc deficiency in school-age children. Zinc deficiency could lead to a dynamic variation in gut microbial composition and function in animals. In conclusion, gut microbial diversity was affected by zinc deficiency, with some specific bacteria highlighted in the zinc deficiency group, which may be used as biomarkers of further clinical diagnosis of zinc deficiency. Or, they could maybe, like I do, measure hair zinc and blood zinc at the same time, and then you get a pretty darn good picture. You don't have to analyze the gut microbiome to try to figure out if you have a zinc deficiency. That seems kind of convoluted to me. So, Handsome Freddy, there's some stuff going on. There's some stuff going on in your stuff. Zinc, it sounds like zinc deficiency is probably in there. Oh, the inflammatory cytokines significantly increase in the zinc deficiency group. Hey, gosh, zinc deficiency is inflammatory. So that's zinc. So again, we connected zinc to the gut microbiome. We connected zinc to intestinal permeability. I don't think there was anything with zinc and SIBO. I don't think there was. Wait. Small intestinal bacterial overgrowth is common in chronic pancreatitis and associates with diabetes, chronic pancreatitis severity, low zinc levels, and opiate use. Well, hey, here we go. Let's just connect them directly. Okay, so here's one thing I want you to understand about toxic bile and pancreatitis. Well, first of all, we've been over studies before here about pancreatitis and vitamin A toxicity. These are connected. So let me find an image so you guys can see it. Pancreatic bile duct, liver, just so we can get an image that covers these things. Okay. So we got this image here, right? Pancreas. This is your liver's up here. Okay, your liver's out of the screen. This is the common bile duct. See, it's labeled. Gallbladder. So cholestasis means that bile is going into places it's not supposed to go. It could back up. Like when you think of cholestasis, stasis is stagnation. Okay. Think of like, let's say a creek where the river or where the flow of water in places, you know how like on the side pools, there's no flow and you get algae there and you get all sorts of just stagnant water. That's so stasis, stagnation, cola is bile. So bile stagnation. Could it just be sitting in an area and not moving well? Yes, that's how you get gallbladder problems. The bile actually paralyzes the gallbladder because it's so toxic, and then the gallbladder doesn't work. Those of you who have had studies on your gallbladder where it's not firing, it's not squeezing, your gallbladder is paralyzed. Bile can also paralyze your stomach. Okay. But stagnation, stasis can mean it doesn't move. It could mean it goes backwards against the flow. It could mean that it's leaking into places it's not supposed to go. That all those things are cholestasis. Okay. Pancreatic duct. Hey, common bile duct right here. What if the bile started refluxing up into the pancreatic duct and then went all the way back up to the pancreas and irritated the pancreas? So we'll get to that in a second. Okay. So let's go into this. 98 of 273 patients had definite chronic pancreatitis and 40.8% had SIBO. Why would they give a number and then a percent? That's weird. That's like they're trying to. What is 98 of 273? Maybe the numbers are too similar. 98 divided by 273 equals 35.8%. Wow, those numbers are so close. Maybe that's why they made one a number and one a percentage. Discussion. SIBO, diagnosed by GBT, occurs in 40.8% of patients with chronic pancreatitis without upper GI surgery. In patients with chronic pancreatitis, markers of more severe chronic pancreatitis, low zinc level, diabetes mellitus, and increased Mayo score, and opiate use should raise clinical suspicion for SIBO. Particularly in patients with persistent steatorrhea, fat in their stool, big thing with bile problems, or weight loss despite pancreatic enzyme replacement therapy. Well, they seem to be connected. Zinc. So let's go pancreatitis. While we're here, cholestasis. Conservative management of cholestasis with and without fever in acute biliary pancreatitis. The presence of cholestasis in both mild and severe forms of acute biliary pancreatitis does not justify these probably really invasive treatments. However, in daily clinical practice, it's practically impossible to guarantee the coexistence of cholangitis, irritation of the bile ducts, and mild or severe acute pancreatitis. Pain, fever, and cholestasis, as well as mental confusion and hypotension, may be attributed to inflammatory and necrotic events related to acute biliary pancreatitis. Acute biliary bile duct pancreatitis. Acute bile duct pancreatitis. They just it's all right there. Acute biliary pancreatitis. So, do you think pancreatic cancer would then be associated with too much bile constantly going back and toxifying the pancreas? There's twice as much bile in the blood of diabetics. They were connecting diabetes and pancreatitis here. bile leakage, cholestasis, small intestinal bacterial overgrowth. Are you seeing the connections? So I think that's all I'm going to do on zinc. Let's go to selenium. There's not going to be as much as we go on from here. Do we need to go much further than the title? Selenium deficiency exacerbated. Oh, sorry. I'll get that link. Let me go back and get that link before I forget. Especially when I find them on the fly, I forget them. Get this one. We'll get this one just to make sure I got them all for you guys. Somebody on Twitter the other day was like, oh no, it was on YouTube. Somebody commented on my YouTube, do you have any evidence to back up what you're saying? And I was like, are you even watching the video? You putz? Like, seriously, do you have any evidence? Like, folks, if you want someone in the research world, if you're going to wait, if you demand that that your acceptance of a new idea is going to wait for research to spoon feed it to you. You want them to spoon feed it to you with a research that says this causes this and this. You're not going to get it. You're not going to get the spoon-fed stuff. Do you think they want to tell you how to fix your problems? No, they do all these individual studies, and then a guy like me comes along and puts them together so it makes sense. That's what I do. I'm not going to wait 30 years for them. Do you want to wait 30 years for them? Do you think we have 30 years to wait before things get really ugly? Anyway, did I do this one? Anyway, let me do this one, and then we'll go back to the selenium one. So, Christopher 3D said, Dr. Smith, do you know that the common antihypertensive losartan depletes zinc? This is in the research. I don't doubt it. I don't doubt it at all. So, let's go to selenium. Selenium deficiency, increased duodenal permeability and decreased expression antimicrobial peptides by activating ROS/NF kappa. Is that gamma? No, kappa beta signal pathway in chickens. Anyway, if I said it wrong, whatever. I'm live. It happens. To simplify, the study also demonstrated that selenium deficiency could increase intestinal permeability. Selenium deficiency could increase intestinal permeability and decrease antimicrobial peptides via reactive oxygen species. Wait, what was that one? Oh, well, this would play a role in leaky gut. Selenium deficiency induces duodenal villi cell apoptosis. Your villi, the very things that go away in celiac, duodenal villi cell apoptosis, cell death. Your intestinal cells are dying from selenium deficiency. Here, I'll just put this link there just so you have it. I think I got both of these now. Selenium deficiency can induce oxidative stress and inflammatory response in the intestines. It can also increase intestinal permeability and decrease intestinal immune function in mammals. So, oh, funny thing, for those of you, again, for the copper people, selenium is a copper antagonist. Zinc is a copper antagonist. You saw what it did to intestinal permeability. Selenium is a copper antagonist. You're seeing what it does to intestinal permeability. You saw that I showed that copper increases intestinal permeability. How many more ways do I need to show you? Let's see, let's go back up here to find this. Trace element selenium effectively alleviates intestinal diseases. Selenium has been proven to be effective in alleviating intestinal diseases such as inflammatory bowel diseases. Let's go find the other one. See, now it worked. Previous studies have stated that the composition of the gut microbiota influences the selenium content in mice, and that host selenium status also modulates the composition of gut microbiota. Did we hear something like this before? Toxic bile modulates the gut microbiome, and the gut microbiome changes the bile, which then affects the liver, which is what makes the bile, the circle of life, right? So we got the bile circle, we got a selenium circle. Diets with different selenium content could affect the microbial composition in rats. Well, no duh, that's what you just said in the previous sentence. Dietary selenium increases the diversity of the microbiome, and changes occur in both selenium deficiency and selenium supplementation. Dietary selenium can affect the composition and colonization of the intestinal flora in the gastrointestinal tract, thus affecting host selenium status and selenium proteome expression. The disruption of the integrity of the gut flora can lead to diseases such as irritable bowel disease and cancer. Selenium supplementation, which increases the diversity of the gut microbiota, may be beneficial in preventing colon cancer, with 3 references there. So, again, remember, SIBO, leaky gut, gut microbiome, liver damage. It's all just, they're just looking at different parts. I'm just bringing it all together and saying, yes, the gut microbiome can affect the bile, which then affects the liver, and the toxic bile that's coming down affects the gut microbiome, which then can change the bile. And then it's this big cycle. I think that might be, did I put this one on there? I think I did. I don't know. If I'm putting these more than once, I'm sorry. This is just a lot of stuff to go over. I think that's it. Okay, Joe, you can take it off of there. So let me, and Nate said zinc, selenium, and molybdenum are antimicrobials. Absolutely. They are all anti-copper. Funny thing that they're antimicrobials. They're antifungal for sure. Yeah, so absolutely. And they're deficient in just about every person I test on a daily basis. So let me just go up here and look back at the start. Ron Meta, if you're still here, he said red thiamine is good for Hep B treatment. Go watch my hepatitis live stream. I don't remember which one it is, but go watch my hepatitis live stream. Hepatitis is a toxicity and deficiency state. It's not viral. Viruses are nonsense. Viruses are evidence of a toxicity state. Okay. Cass asks, a family member of mine is 40, eats healthy. Okay. Eating healthy doesn't, those words to me mean absolutely nothing. Because people who are eating healthy, as you guys know in the comments, they come to me all the time because what they thought was eating healthy was the opposite, like eating tons of vitamin A. Really high cholesterol. Cholesterol is, the sooner you all start thinking that cholesterol is an indicator, especially LDL cholesterol, is an indicator of liver toxicity. So what are they trying to sell you? Oh, you need bile to digest your fats, and you need bile to make your hormones. You need bile to make vitamin D, and you need bile. They keep telling you how wonderful bile is and how much you need. I'm sorry, cholesterol. On both sides. I mean, the alternative side is like, eat cholesterol. LDL cholesterol contains vitamin A. Why would it contain vitamin A? LDL cholesterol is the bad cholesterol and it contains vitamin A. Interesting coincidence. LDL cholesterol may be one of many potential indirect indicators of vitamin A toxicity. Okay, so here's what we want. Don't try to eat cholesterol. Cholesterol is it's an indicator of toxicity. So don't eat toxic stuff. But I'm also not going to say you have to go on a super low cholesterol diet. Just don't. Do you think I obsess on cholesterol here? No, I don't obsess on cholesterol. But if somebody has really high cholesterol, they're toxic. Now, on the other hand, people will say, but low cholesterol is bad too. I was just going over this in my inner circle earlier today, making that up because I'm not going to miss a week. If somebody has low cholesterol and they're unwell, that's a bad sign that their liver is not functioning well. They're not making the waste product. So where do you think the waste is getting trapped? In their liver. It's not escaping. Somebody with high cholesterol, the toxicity is escaping their liver. Some of it has cholesterol, and they're making a lot of it. Their liver's really toxic. This is like the over and under types. Overs tend to make a lot of bile and a lot of other stuff, and unders tend to not make as much of it because I believe it's stuck in the liver and it's leaking. It's intrahepatic cholestasis and it's leaking back into the blood. So you can have two different presentations. Now, those of you who are familiar with Grant has very low cholesterol after all these years of avoiding vitamin A. Does he have hormone problems? No. You can earn low cholesterol if you are doing a low vitamin A diet and doing things right, and you get to low cholesterol. Grant's doctor, Grant told me that his doctor said he had the cholesterol of a 5-year-old. And I just looked this up in the inner circle. Do you know that cholesterol levels tend to rise as we age, up to about age 80? Do you know that vitamin A levels rise as we age? Weird that goes together after I just told you how they're connected, right? How do we fix high cholesterol? We don't try to fix it. It fixes itself as we get rid of the toxicity. That's basically what we do. But somebody saying they eat healthy to me means nothing. I mean, no offense. If people understand how I suggest to eat and they're saying they're doing this stuff, then I'm going to say, okay, yeah, you're eating healthy. But eating healthy as a term itself means absolutely nothing. Highest cholesterol I ever had in my life, a total of 280, was when I thought I was eating healthy, doing stupidity stuff like bulletproof coffee and paleo with tons of sweet potatoes and cooked carrots and spinach and arugula, supplementing astaxanthin, just vitamin A toxicity up the wazoo. And people would have looked at me and be like, whoa, you're so healthy, dude. And I was like, no, I was slowly. When you run out of the magic of youth and you're vitamin A toxic, those of us here understand it's not a fun drop off. When all that toxicity you've been putting in finally catches up. So Sydney asks, what are your thoughts on protein powder and supplements? Are there any that you think are worth using? I think the beef protein powder is probably full of organ meats and probably absolutely toxic. Why would they use ground beef in that? Why would they use normal beef in that if they could sell the beef for good money, not as a beef protein powder? And I'll put it this way, if somebody is paying like beef prices for like meat prices for ground up meat protein, oh my gosh, eat the steak. I would laugh at somebody who, if they could pay the same money, they were eating beef protein powder instead of a steak. Like, seriously, what kind of world has it come to? I think collagen good collagen protein is about the only protein powder that I think is even, you could get organic gelatin or organic collagen. That's about the only protein powder that I think is acceptable, and I would use it as little as possible. I would rather eat a beef stick than use collagen. Collagen is like last resort. So Nature Sound says, hey, big fan of your work here. Well, we're happy to have you then. After getting borreliosis, I have severe nausea and poop 4 to 7 times in the morning with irregular stool type. What would you suggest? Thank you so much in advance. Well, there are suggestions on loose bowels in the Love Your Liver program. There's like a 15 article section on charcoal. Charcoal is the quickest and easiest thing to help with nausea, because your nausea is bile in your stomach. And the pooping 4 to 7 times in the morning, you're probably dumping bile at night before you wake up. And then you're waking up with all that bile causing your nausea and causing you to poop. It's the same thing as morning sickness in pregnancy. So things that I might, I'm not your physician. So these are just things that I'm saying I might try if I was talking to, let's say, a family member or doing it for myself. I would look into charcoal for orally, charcoal powder. You want charcoal powder, not charcoal capsules when you are trying to address the stomach, because you want it already dissolved and able to touch your stomach. You don't want it in capsules where it might pass by your stomach, because then it can't absorb the bile that's causing your nausea. So charcoal powder and water. I can't give doses here because figuring out your dose of charcoal is something that you got to figure it out on your own. But if you have capsules, just remember capsules, for the privilege of them making you charcoal capsules, they charge about 11 times more per gram of charcoal. So if you want to pay 11 times more per gram of charcoal only to do what I recommend, which would be to open up the capsule and put it in water, I mean, you can. Why would you? I like hardwood charcoal. I don't generally recommend coconut charcoal. If that's all you can get, and if you live in America, you can find hardwood charcoal. But if coconut's all you can get, it's okay. If you can get bamboo charcoal, that's better than coconut. So the first thing we want to do is, with charcoal in pooping too often, would be just to slow down the frequency of the poops and get them to firm up a bit, and charcoal could help that fairly quickly. If you got constipated from it, you took too much, so back off. So that's basically that. There is other stuff. Lactospore is a probiotic that has quite a bit of research on helping with diarrhea conditions. Oh, I forgot the super chat from John. John is asking any suggestions or ideas for chronic sinus infections. Okay, so chronic sinus infections. One of the big things about chronic sinus infections is they can be fungal related. So, what are the antifungal minerals we use? I already went over those earlier. Correcting zinc deficiency, correcting selenium deficiency, correcting molybdenum deficiency. Those are the big fixes for fungal stuff. And then obviously we want to reduce the toxicity that is allowing the fungus to grow. So those are just things that internally, deficiency-wise, we could help. Now you could get into things like nasal rinses, Neilmed. I think the neti pot, compared to a Neilmed, if you know what a Neilmed is, the squeezy bottle that you can put in one nostril and wash out your nose to the other side, that would be helpful. If I was talking about myself, there's a section on chlorine-related compounds in the Love Your Liver program that I don't discuss out on the general internet, that I would probably put in the sinus rinse. A couple drops and use that probably twice a day. So yeah, further questions on that will not be addressed on the public YouTube channel. But yeah, so we would be hitting the internal stuff, the deficiencies. We would be hitting the external stuff. If there's toxic metals around, those will also increase fungal growth. So, hold on. Let me turn. Joe's saying my frame rates are getting bad. Let me turn on the light now because it's getting kind of dark outside. Okay. So there's the internal light. We'll see if that fixes it, Joe. It might just be that it got too dark in here. Because, yeah, it looks like the clouds came in. Or maybe it's the artificial cloud cover. Maybe they've been spraying that today. Anyway, so that, John, I hope that helps. Definitely, like, that could, don't go, okay, folks, don't, again, I love zinc, but Zicam, that thing where you can spray zinc up your nose, no. Go and look up how many people have lost their sense of smell from shooting zinc up their nose. Do not shoot zinc sprays up your nose. Don't do it. Okay. Yeah, I would definitely. Oh, so yeah. The charcoal, you could try taking it to help with the morning stuff. This is where you're going to have to experiment. There's really 3 times you could try taking charcoal to help with this morning, if it's mostly in the morning issue. Before bed. That may or may not last. That may or may not like sit there long enough. It may move through you too fast to catch the bile dump. You could take it in the middle of the night if you wake up in the middle of the night. Or you could even set an alarm in the middle of the night. 2 in the morning. Usually the bile dump happens about 3 a.m. for most people. So you could set an alarm, wake up, have a glass of charcoal on your nightstand. Your alarm goes off, wake up, stir it up, drink it, go right back to bed. Or if you have time in the morning, before you're getting out of bed, before this all starts, before the nausea starts, before the pooping starts, you could, as soon as you wake up next to your bed, you got the glass of water with the charcoal, stir it up, drink it, see if you can abort the whole process by doing that. You're just trying to time the charcoal to when it works for your life and when it is close enough to the bile dump that is causing the symptoms to absorb it. Let me just see if there's anything on. No, nothing on Borrelia and bile. So I hope that helps. Oh, CK was asking about the high cholesterol person. Does she like to eat milk products? Does she eat eggs, sweet potatoes, and or tomato products? All are high in vitamin A, which I believe raises LDL. Yes. Oh, and the other thing, I don't know if I caught that, but if you caught that, blood vitamin A rising as people get older and cholesterol rising as people get older. It's toxicity accumulating over time. That's why this is doing that. That's why they go up together. But yeah, the new stuff. Oh, here we go. Let me find that so I can see it all. John's super chat, activated totes, unspecified chlorine compounds. I've mainly been using the unactivated in my NeilMed sinus rinse, but you could do the activated as well. Either one could work. He says, yeah, peroxide would be easier for you, but feels somewhat dangerous. Never shot anything up my nose other than salt water and some strong essential oils. Well, you know, the fizzing up in your nose, I mean, okay. Putting things in a sinus wash. First, you're going to be putting salt or baking soda, sodium bicarbonate, either sodium chloride or baking soda, sodium bicarbonate, or a mixture of both into the sinus rinse. Do not squeeze straight water up your nose. Okay? You'll know why. It won't feel good. It'll feel terrible. It's not going to hurt you. I mean, it hurts. It's not going to damage you, but it's not fun. So you want to, what do they call it? You want to make it isotonic to your tissue, your fluid concentrations of minerals and stuff like that, so it doesn't sting. Now, the compounds that we were talking about, those easily combine with salt and baking soda. Other things that people might put in there, peroxide. I don't want it fizzing inside my nose. I'll put it that way. I don't want the fizzing inside my nasal passages. Finally, there is colloidal silver. If somebody wanted to run some of that through their nose. The only thing I want to say about colloidal silver is if you're going to add salt to it, sodium chloride, there is a concern that the silver may bind with the chloride ions and make silver chloride, which you don't want. That is why I have never used colloidal silver in a sinus wash, because I put in salt. I use the packets that come with the NeilMed, and I'm not going to mix them with colloidal silver. Could you just do baking soda? I guess. Maybe. I haven't done it yet. I'm not out trying to DIY it on the salt and bicarb mixture. I just want it to be quick. So that's what we got. So Handsome Freddy, just real quick on this. Any tips for symptoms of low mood, low energy, scalp folliculitis, chest ache, and very pale and mucousy stools? I have SIBO, dysbiosis, and leaky gut. So if you watched this whole show, if you haven't watched the whole show, I would go back and watch it all. But let me explain these things. So these presentations. Thank you for this. I'm sorry, I forgot to say, John, thank you for the super chats, and Handsome Freddy, thank you for the super chat. Chest acne. Okay, not chest ache. Okay, got it. So let's just go through the things that I would normally associate with the symptoms you have with the things that we just went over in the research. Okay. Low mood, low energy. These go together. Now, normally, the very first things that people can do to help these conditions. Well, let me do a new window. And we'll do just seeing if there's any magnesium connected to SIBO. I think I didn't find anything before. No, nothing connected. Okay. So nothing on magnesium. Let's do this other one as magnesium intestinal ability. Let's just see. Study of magnesium formulations on intestinal cells to influence myometrium cell relaxation. Data showed a better influence of buffered chelate bisglycinate. Magnesium glycinate is really what that is for short, on intestinal permeability and myometrial relaxation over time, with a maximum effect of 3 hours and greater availability compared to the sucrosomial form. So magnesium helps with intestinal permeability. Okay. The two things that I would think of when I think of low mood and low energy first is I think of magnesium deficiency and I think of potassium deficiency. So now let's go do potassium intestinal permeability PubMed. Well, there you go. Low potassium disrupts intestinal barrier and results in bacterial translocation. Conclusions: low potassium diet could increase intestinal permeability and thereby lead to bacterial translocation. So, now I have instructions on magnesium, topical magnesium applications, and potassium. I have, I think, 6 different things in the Love Your Liver program on potassium. So the things that could help, obviously we're connecting. Oh yeah, all these links. Let me do this. So there's that. And there's this. The things that can help your mood and your energy the quickest, like within a half hour, is to figure out your topical magnesium and to figure out your potassium, whether it's foods or supplements. So I didn't get to the potassium and the magnesium on my research on this, but there we go. If it's connected to intestinal permeability, it's connected to gut biome. If it's connected to all that, it's connected to small intestinal bacterial overgrowth, and it's connected to liver damage. Okay, so they're all connected. So if we find one of these things, it's all connected upstream. So potassium, correcting potassium deficiency and correcting magnesium deficiency is the quickest way to help with anxiety, depression, low energy, brain fog, that kind of stuff. Okay. So then we talked about, let me see, low mood, low energy, scalp folliculitis, chest acne. When I think of skin problems, I think of vitamin A toxicity and zinc deficiency. Zinc deficiency is huge in acne. Maybe I should do acne. Maybe I'll do acne next week. And I'll connect it to all of this. That sounds like a good idea. So zinc and acne. Whenever I hear skin conditions, I think zinc deficiency. And of course, vitamin A toxicity. Copper toxicity goes in there too, because both vitamin A and copper deplete your zinc. They use up your zinc. And we saw here how zinc deficiency helped with the intestinal permeability, and it helped with gut diseases and all that connecting. So that would connect the scalp folliculitis and the chest acne. Very pale and mucousy stools. Well, this we don't force this to fix itself, but pale means your stools do not have very much bilirubin, also known as bilirubin, in it, but you're having all these other symptoms, which means, like we talked about before, your bile is going into your blood, including your bilirubin. It's going into your blood, causing you systemic symptoms. It's coming out of your skin. That's your skin problems. It's going up to your brain. That's your low mood, low energy. Your poop is not dark because you don't have a lot of bile in your poop. So that's the connection there. And then the SIBO and dysbiosis and leaky gut, we already connected all those. Those are absolutely interconnected, and that's what we went over with in terms of the bile, toxic bile theory. We went over it in terms of vitamin A toxicity. We went over it in terms of copper toxicity. We went over it in terms of zinc deficiency, and selenium deficiency and magnesium deficiency and potassium deficiency. Now, if you wanted to know what I suggest to do, if you would like to get access to my life's work of how to fix these things, that's the Love Your Liver program. Now, wait 1 second. So the Love Your Liver program is at members.nutritiondetective.com. That's the do it yourself. Now, if you wanted to work directly with me or with Nathan, my second in command in terms of helping people with consults, Julie is really the second in command. Nathan is my backup, my helpful man on the side who is taking clients as well. So either of us can help you with the hair testing, the blood testing, and then if you do a consult package with Nathan or I, you get lifetime access to the Love Your Liver program included in that. So if you buy the Love Your Liver program before you do a consult, you don't get it refunded later, folks. You're getting a lifetime package. So if you buy the Love Your Liver program first, and then you get a package later, you don't get a refund on the package because you just got lifetime access, which is worth more than $99. Joe's saying Julie's first in command. Well, if I didn't have Julie around, I don't know what I'd be doing. So in certain ways, maybe you're right. But that's how we, so access. Somebody on Twitter was like, they couldn't believe that I charged $100 for the Love Your Liver program, as if I'm supposed to give my life's work away for free and I'll just starve with my family. You know, my family and I'll starve. I don't understand how people think the world goes around. I bet that guy goes to work every day and expects to be paid for his work. And here I am trying to change the world with my work. And yet, because it's health related, people think that I should give it all away for free. I'm not saying you're doing that, Handsome Freddy. I'm saying if you want my advice on how to deal with these things, and if you wanted the potential assistance and help and feedback from the over 2,000 people that are in the Love Your Liver program, it's like a social media network in there. Like you can ask questions and other people will answer you and help you out. And just so you guys know, in the network, I haven't been getting to questions lately in there because I'm trying to finish the secret weapon stuff with Kelsey. That's this week. We're going to finish that. We're going to release that this week. It's going to be awesome. So yeah, Handsome Freddy, he said, thank you so much, sir. Yes, I would like to work with you. That's awesome. If you want to, you can email Julie at admin@nutritiondetective.com. That website's also on that email's also on our website, nutritiondetective.com. And, honestly, folks, if maybe someday, so the nice thing about, when people get things for free, they don't respect it very much. They don't value it very much because it has no value, right? It was given to them for free. You must have skin in the game, as they say. And like when people talk about Ray Peat giving away all his stuff for free, I go, well, he had a nice cushy university job that was not dependent upon nutrition. And he had no skin in the game because he had no clinic and he had no paying patients. And you know what I've heard would happen to people when the stuff Mr. Peat was suggesting to them didn't work enough times in a row? He would simply stop replying to their emails. The word that comes to mind for that is chicken shit. I had a gentleman I worked with for 10 years trying to fix his GERD. I couldn't fix it until I figured out the vitamin A toxicity thing. And he stuck with me because he said, you were the only doctor who listened to me and didn't think I was crazy or that I was lying about he could only eat, there was a time where he could only eat 3 foods. And you know what I told this gentleman at one point? I said, honestly, I don't have any more tools. At that point, that's what I said to him. I said, I don't know what to do for you. And I'm not going to drag it on and keep jerk in your chain and be like, oh, let's try this. Let's try this. Let's take 20 million supplements just so, so I can make a buck off of you. No, I told him, if you want to go look for somebody else, I mean, I don't have any more tools at this point. He was like, no, I'm going to stick with you. And then eventually we figured it out. So his belief in me paid off, which is really cool. Gave him his life back. So anyway, this is what we're trying to do. And I think we got all the super chats. Thank you for the super chats, y'all. I got to get going. I got to let Joe go. So I think we're going to wrap it all up. Keep watching for the secret weapon this week. And yeah, Joe Zendog Breath says, become a philanthropath with a not-for-profit if you want to be wealthy as Rockefeller. I got it. Just watch what the Rockefellers do, right? That's how you can make lots of money. Are they making people healthier? No, they are not. So anyway, hope you all enjoyed it. I did. I will see you next week. I think, somebody said, please do acne next week. So I'm cool with doing acne. And sorry about the weird time. I was in LA with my kids. My daughter did a dance competition and my boy is a huge Star Wars fan. So he wanted to go to Star Wars Land at Disney. And we did all that. It was super fun. And I hope I never have to go to LA again in my life. I can't understand. Those of you who live in really big cities, man, it's got to be impossible to be healthy there. Like, I'm in a decent sized city in Tucson, but the really big ones, those places are so toxic. Anyway, you all have a great week. I will see you next time. Bye now.